How does Pseudomonal infection impact advanced CF lung disease? Imagine living with cystic fibrosis where thick mucus builds up in your lungs, making it hard to breathe. When Pseudomonas aeruginosa infects the lungs, it makes everything worse. This bacteria is a common and serious problem in advanced cystic fibrosis lung disease. It causes long-lasting infections that damage the lungs over time. The bacteria love the thick, sticky mucus caused by the defective CFTR protein. They form protective communities called biofilms that are tough to treat with antibiotics. These biofilms shield the bacteria from medicines and the immune system, allowing the infection to stick around 4 years. As the infection persists, the body's immune response kicks in. But in cystic fibrosis, this response is often overactive and causes more harm. Neutrophils, a type of immune cell, releases enzymes and chemicals that damage lung tissue. This ongoing inflammation leads to scarring and airway remodeling, which worsens breathing. The damage caused by Pseudomonas makes the lungs less able to clear mucus and fight infections, creating a cycle of worsening health. In advanced cystic fibrosis lung disease, Pseudomonas infection is linked to a steady decline in lung function. Patients may notice increased coughing, shortness of breath, and frequent flare-ups. Over time, this can lead to respiratory failure, where the lungs can no longer provide enough oxygen. The bacteria also tend to become resistant to many antibiotics, making infections harder to control. Sometimes, Pseudomonas coexists with other bacteria like Staphylococcus aureus, which can make the infection even more difficult to treat and increase lung damage. Even with new therapies called CFTR modulators that improve the underlying defect, Pseudomonas can still be a problem in advanced stages. These treatments may reduce bacterial numbers and inflammation, but often do not fully eliminate the bacteria once the lungs are heavily damaged. This highlights the importance of ongoing infection management, including antibiotics and other therapies, to slow down lung deterioration. In summary, Pseudomonas aeruginosa infection in advanced cystic fibrosis lung disease creates a cycle of persistent infection, immune response, and lung damage. It is a major factor in the progression of the disease and a key focus of treatment efforts. Managing this infection carefully is essential to help improve quality of life and prolong lung function. Always consult healthcare professionals for personalized advice and treatment options, as each person's experience with cystic fibrosis can be different.